Hi everyone, Dr. Harmon here. Today I'd like to talk about some of the features that can identify whether an individual has had a cheek lift as a result of facelift surgery. Now it's important that a patient get a cheek lift from facelift surgery because it is one telltale sign of aging. And so if you have an improvement in your jowls, meaning the lower part of your face and your neck, but no improvement or lift of your cheeks, it can make the procedure look a bit artificial or incomplete. That's the benefit of deep plane facelift surgery, and one of the benefits of extended deep plane facelift surgery, which is an advancement upon the technique, and it's the technique I utilize. Now, every patient's different, meaning they have different ligament sizes, different amount of fat in their cheeks, so everyone experiences different extent of change as a result of deep plane facelift surgery. But there are three things you can look at that kind of give you a sense of that improvement. Now, the whole idea behind getting a cheek lift with facelift surgery is that the cheek fat in the upper part of the cheek tends to fall down and forward and hang over what's called the melolabial fold or nasolabial fold. That fold is a ligament that separates the cheeks from the upper lip. And that can become accentuated because the volume that used to sit up here starts to hang down and forward. And so bringing some of that volume back up and out can not only make the face appear more heart-shaped, which is more youthful, but there's some other more subtle features that are best noticed in people when you're facing them in person, but you can also sometimes see in videos and photos. The first is that you can get an improvement in the depth or the appearance of the depth of the nasolabial folds, and that's simply because the fat is pulled up and away a little bit. Now, it doesn't eliminate the appearance of the nasolabial folds, and you necessarily wouldn't want it to, because eliminating that transition point can also make an individual look artificial. The second thing that you can sometimes notice is in certain individuals, especially those who have pretty severe drooping of fat, you can get a depression that extends across the cheeks that separates the bone up here, which is a very prominent bone, and the hanging fat that I just mentioned previously. It's called a cross-face depression. So bringing the fat up closer to that location, closer to the bone, can reduce the appearance of that cross-face depression. And then the third feature that you may notice is that the height of the eyelids, or especially if you have severe eyelid bags from the aging process, can sometimes appear shorter, and that can improve the appearance of the eyelids, even though the main reason why people develop age-related changes in the eye is what's called pseudoherniation, or pushing out of the fat in the lower eyelid resulting in eye bags. This can still improve the appearance, it just isn't the same as if you were to do a lower eyelid surgery. And that's partially because one of the telltale signs of aging around the eye is a deepening of the tear trough, which sits right here, and it's like the nasolabial fold ligament that separates fat pads, meaning the fat pad from the lower eyelids and the fat pad from the cheek. And so if you have the cheek falling away from that tear trough, it can make the eyelid look relatively longer, even though it hasn't necessarily changed in length, but also can worsen the appearance of the tear trough on top of the changes that occur around the eye. So it kind of lends to the fact that when we consider age-related changes of the face, everything's sort of connected, everything blends in with each other, and the goal for facelift surgery is to try to not remove volume or to add volume artificially if you don't need to, but simply to bring volume closer to where it was before to improve the appearance of the face, both at the top of the cheeks and down along the jawline and the lower part of the cheek.